Good morning, everyone. I hope you're all well. I'm delighted to have the opportunity to speak to you here today to share the learnings of the remote family cooking project, which was delivered in Galway City as part of the Safe Food Community Food Initiative in 2020. So at the beginning of 2020, like everyone else, we had very different plans for the year. We were going to deliver the Healthy Food Made Easy programme and two large community events to promote healthy eating among families. But we had to adapt, and something really positive has come from that. So it all started with the Let's Cook Together pilot project, which was developed by Froiga Ballinfoyle, following a multi-agency network meeting, which raised concerns about how families and young people were coping with the COVID-19 restrictions, and cooking was identified as something positive that could help to support and engage families during the lockdown. So the project itself was developed and led by Martha, who was trained as a Healthy Food Made Easy leader in February last year. So she developed the 4-week pilot project where the ingredients were supplied each week, and 5 recipes were selected from the Safe Food YouTube channel and website. And the families were supported remotely by phone or video call, and they received an ingredient pack each week with a laminated copy of the recipe. And then the families were asked to record the cooking process or the finished product by taking photos and sending them back to Feroga. GRETB were also involved in the pilot project, as they had trained Healthy Food Made Easy leaders as well. So between Feroga and GRETB, there were 17 families supported over the 4 weeks, and each family also received a copy of the 101 Square Meals cookbook, which was provided by Safe Food. Following the success then of the pilot project, there were 2 additional projects delivered over the summer and winter months to 5 communities. So those communities were Knocknacara, Ballinfoyle, Cara Brown, Duishka and Ballyban, and there were 8 organisations involved in the delivery of the project. So Galway City Partnership, Feroga, GRETB, Tusa Family Services, the HSC, the 3 local shops, and of course Safe Food, who were central in terms of providing the resources, the 101 Square Meals cookbook, and also the portion plates, which were a really practical and useful resource in terms of explaining the importance of portion control to families. So there were 67 families supported then through the 2 additional projects, and there were 268 ingredient packs supplied. So the impact then of all this and what the families said and what they learned. So there were a lot of learnings over the 4 weeks, and families gained a lot of information in terms of the importance of healthy eating, food safety, portion control. They developed basic cooking skills and had the opportunities to try new foods that they may not otherwise have tried. One family said that they had never bought fresh fish before because they didn't like the smell of it, but then the children loved the fresh, the homemade fish fingers, and said they were much nicer than the frozen ones. Similarly, another family said that they never bought any type of beef other than mince before because they didn't know how to cook it or what to do with it. So when they were given the diced beef to make the beef stroganoff, it kind of opened their eyes and gave them confidence in terms of trying different foods, because they were given the recipe and the demonstration video, which showed them step by step how to cook the meat. So the project was also successful in terms of reducing tensions in homes. It was something positive that families could engage in together, and the whole family could get involved. I suppose there was a lot of negativity around during COVID, so this was something fun that they could engage in together. The 101 Square Meals cookbook was also a huge success with families, with families trying different recipes between the sessions. for themselves, and also sharing those recipes with family and friends. We did get a lot of requests for additional copies of the cookbook where families may have shown it to a neighbour or a friend and they wanted to keep it. So then they needed another copy for themselves. So the healthy recipes and the healthy eating messages were really getting out there to the families involved in the project, and also by word of mouth. So these are just some of the pictures that were received from the families. As I mentioned earlier, participants were asked to record the cooking process or the finished product and to share those with the youth worker or tutor each week, and just to kind of to monitor that the families were engaging in the process. And also each of the families received a pack, a Healthy Galway City bag and pen, the 101 Square Meals cookbook, and the portion plates, which were supplied by Safe Food. So there were lots of different meals cooked over the 3 projects, and lots of, I suppose, new ideas and family favorites. There was some feedback in terms of the chicken curry that the kids have gotten the parents to cook it on numerous occasions since, that they enjoyed it so much. So that's all positive. So in terms of the key learnings then, I suppose the collaborative approach really was central to the success of the projects. In terms of Galway City Partnership, the community development staff were central in terms of creating the links with the agencies and the families on the ground. The Feroga, Tusla Family Services and GRETB staff, in terms of planning the programme delivery, liaising with the shops, organising the ingredient packs, deciding on the recipes, printing the recipes, laminating them, supporting the families over the phone or by video call with any queries. I suppose getting the photos each week and encouraging the families in terms of how they're getting on, following up with them, with any families who may have forgot to collect their ingredient pack, to remind them that it's there. And also the shops were also a huge component to the collaborative approach, as they prepared the ingredient packs each week and worked with Feroga, GRETB and Tusla Family Services, ensuring that ran smoothly. Also the HSE and Safe Food in terms of providing the resources. And another of the key learnings then was around the supporting and supporting and engaging families during COVID-19 restrictions. It was something positive for families to focus on, and the project helped to keep those lines of communication open, where Feroga, GRETB and Family Services could continue to engage and support with families during the restrictions. The local shops then were essential to the success of the project. They prepared the ingredient packs each week and included the laminated recipes in the packs. And something that came from the pilot project was the use of a ticket system, where the families were given 4 tickets at the beginning of each project with a code on it, so that the shop could identify the families who were taking part in the project, and any families who had forgot to pick up their packs could be identified and could be contacted just to remind them that the packs are there. Also that the shops were local and were central in the communities. It allowed families to walk to the shop to pick up their packs, to incorporate physical activity into their day. In some instances, families were unable to pick up the packs themselves for various reasons. And in these cases, the workers facilitated a drop-off service. And while this was challenging and time-consuming, it was also very positive in terms of it gave the workers an opportunity to check in on families and to just have that social interaction, while adhering to the public health guidelines and social distancing rules. It just gave that social interaction at a time where that was really lacking. Finally, then the project used all the safe food resources, the YouTube videos, the recipes on the website, the 101 square meal cookbooks, and the portion plates. And they were really essential in the delivery, in terms of having ready-made and I suppose trustworthy sources of information and of recipes to base the program on. In terms of the key learnings then, or the successes, there were 84 families supported through this family cooking project in 2020. And I just want to acknowledge the support and funding from Safe Food through the Community Food Initiative, and also the co-funding through Feroiga, which helped us to support additional families during the project. Feroiga Knocknacara and Feroiga Ballinfoyle were also successful in securing additional funding through the CFI at Home Fund to support additional families during the winter months. So overall, there were well over 100 families supported in Galway City through the CFI last year, which was really fantastic. Following the success then of the pilot project and the subsequent projects, the model has now been expanded to County Galway through the SIPSI Healthy Ireland Fund in partnership with Feroiga. And we are also continuing to roll out the family cooking project in Galway City in 2021 through the Safe Food Community Food Initiative, currently supporting 65 families in Galway City. And we're also exploring alternative funding mechanisms to continue the rollout of the project for the remainder of the year. So finally, I just want to thank everyone who made this possible, to Safe Food and to Sinead from CCAD for all their support, to Feroiga, who's the Family Services, GRETB and the HSC, and also to the Galway City CFI steering group, because without all of you, this would not have been possible. So just to say thank you again, and I'd be happy to answer any questions that you might have.